Good evening, future physical therapist assistant students. Welcome to the Lone Star College Montgomery's Physical Therapist Assistant Program information session. I hope you find this evening to be enjoyable and that you learn what physical therapy is, what a physical therapist assistant is, how to apply to our program, how to complete our program, and graduate as a licensed physical therapist assistant. Please enjoy a couple minutes of a video clip from the American Physical Therapy Association that discusses what it's like to be a physical therapist or a physical therapist assistant. Here we go.
I teach, I learn, I invent, and I care.
You have to be able to communicate.
Motivate.
Every experience is different.
There's no cookie cutter approach.
And it's rewarding.
I strengthen.
Enable.
I treat.
We heal.
You're helping those who can't do.
Caring.
Educating.
Encouraging.
Just helping people.
Funulating.
You need to go in with a completely open mind because something very cool might come out.
I'm a physical therapist here at the National Rehab Hospital in Washington, D.C. This is the cardiac rehab, so we're working with patients with heart conditions. You get to use your thinking skills, analytical skills, problem solving. I did her BP 135 over 95, and you get to do so much. It's really awesome.
Right now we're in Independence Square. It gives the patients an opportunity to practice the things that they've been working on in a real world setting. So this is a kitchen that we're in right now, and it's set up just like any other kitchen. The sink works, it's got knives, it's got plates, it's got food, and you get to practice. The best thing about being a physical therapist is getting to see your patients improve. When you get to see them go home on that last day and they're walking out, when they came in a wheelchair or they came on a stretcher, and you get to see them leave, walking.
We're going to walk down, touch the wall, come back to the exact same spot. I'm a board certified neurospecialist in physical therapy. I see everything from spinal cord to people who are dizzy, stroke. I mean, people who come back from Iraq. I mean, you name it, we see it. We're looking to see what we can do to maximize his overall function. It's never boring. It's always different, and you can actually try to pull in your clinical reasoning skills, the best evidence that's out there, what the patient values, put it all together and see whether or not you can really make a difference.
I see mainly geriatric patients in outpatient therapy, so I treat a lot of the cancer, rehab, and the lymphedema population. I think the best thing about being a physical therapist is that you are a motivator and a coach. It's not meant to be deep, because the lymphatic system is directly underneath the skin.
I am a student physical therapist. Here, within a neuro setting, certainly you put your hands on, so you teach the patients what to do. But there comes a time where, it is just mental. So you put your hands on the patient, it's now time for them to do as much as they can.
I'm Tim Dockin, physical therapist with Fairfax County Public Schools. Will has cerebral palsy. Good. I sit down? Yeah. More than just being a physical therapist, I think, we're an advocate. And so we see so many aspects of these kids' lives and that we can help them out.
You're touching the side. Try not to touch the blue.
Our whole goal here in the middle school is to prepare them for high school. We make most everything into a game. All right, there you go. Oh, nice one. So the more fun we can make something, the more willing they are to do it. Okay. Got it. Good job. Andy had meningitis when he was a kid and had some brain damage because of that. 3, push up. Good, 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 good. Stand up there. No, don't you sit down. Don't you sit down. When I had decided to change careers and go back to school, I went in an outpatient clinic and I saw how they were getting people better. Down, reach with your hand. The people I worked with were great, and the difference you made in these people's lives were great. This is Andrew, and he's 12 years old. He has cerebral palsy, so he has trouble controlling his movements. And both together. Okay, Andrew, stop. Okay. Stop! Stop! We want to get them to do as much as they can themselves. Oh, that's perfect. Okay, we're doing donuts. That's not supposed to happen until you're 16. Ha ha! It's just fun because you've made a difference.
I'm Denise Constanti. I'm a physical therapist with the Jackson Clinics. You definitely need to have your hands on the patient and feel how the muscles are working and seeing if they're flexible. You have to have all 3 things coming together: flexibility, strength, coordination. I've actually come from this from the inside out. I was an amputee at a very young age. I had a prosthetic all my life. You learn to overcome, and I wanted to teach others how to do that for themselves too.
And what we call the ligaments, the things that keep the leg together. I'm a physical therapist assistant. All right, so now we're working your knees. If you want to be a physical therapist, you want to have a passion for the human body, because that's what you do. The human body is your business. Stabilize.
I used to have a problem with walking on the outside of my toes.
So what we wanted to do is teach Nikki to land more with her feet straight, and notice that when her foot is like this, she has got a normal arch. With every physical therapist who works with any athlete, you want to see your person win. And I want to see Nikki win, and I want to see her go out there and win medals. Hey.
My name is Virginia Howe. I'm a physical therapist. We're in the MATC. It stands for the Military Advanced Training Center.
I just want to get up and walk, or just, and I can't. I've learned how to do everything again. You know, my legs were taken away from me. You know, I need to learn how to live all over again.
When you are missing your knees, like Brian is, and you get mechanical knees or computerized knees, you have to relearn how to walk in a different way than you did before.
I'm the research physical therapist at Walter Reed, and I do a little bit of clinical work through my day, but as a research physical therapist, I'm also doing research through military grants. Andrew's actually just learning on the power knee.
Well, I can see the potential it has, but right now it's just trying to get used to when it's going to move and how it's going to move. It's just really difficult.
So all of my day is spent doing amputee research and treating amputees. And then some of our research is early rehab, some of it's late rehab, some of it's to do once you go home. We try to hit all aspects of care. That red line that's coming up when he's walking over this gray area, for the joints that you do have left, your hips and you're on this side, your knee and your hip, you want to kind of minimize those forces or make them as normal as the knee would expect. These guys are great to work with. They're unbelievable. It's orthopedics to the extreme because you're doing sports med, orthopedic rehab, but with a patient population that wants to do that and they don't have legs and they don't have arms, and you have to figure out how they're going to do it, how they're going to run and jump and ski.
I would like to be able to run my 2 miles in 13 and a half minutes.
This will be him in about 9 months to a year.
it's fun, it's creative, and they make it an extreme challenge every day.
You can be me.
You can be me.
You can be me.
And you can be me.
All right, we are back, and I hope that video inspired you. Let's get back to our session here. So what we're going to do today is we're really going to talk about how you can become a physical therapist assistant. I think there's a couple of themes that show up in these vignettes. The first thing you need to understand is that this is a person-to-person profession. So you kind of have to like people. You also kind of have to like the human body and the way it works. Taking someone from where they are now to where they were, or even better, takes a certain amount of coaching and facilitating. You're not going to be able to do this for them, but you will need to facilitate your patient's progress through a certain set of goals. So now let's go to the PowerPoint, and I want to discuss how we get there. Let's see. All right, I am going to try and start sharing my screen with you. And here we are. So now what you should see is you should see the PowerPoint presentation for today's session. We're going to work through this just a little bit and kind of come up with some things that I want to point out in our application. We've already seen the You Can Be Me, and I think I said there were 3 things. So 1 is that it's interpersonal, 2 that it's musculoskeletal, and 3 is that you need to like to be a coach. It doesn't matter if you're an introvert or an extrovert. What does matter is that you actually truly like making people go from one functional level to another through the use of their musculoskeletal system. Now, there are 2 different entry levels for this profession. One is a physical therapist and one is a physical therapist, and you saw that in the vignette. The physical therapist is a doctoral prepared program. You would need 4 years at least of a bachelor's degree, followed by, at a minimum, 3 years of a doctoral degree. In order to get into those programs, which Lone Star College does not provide, you would need to start at Lone Star, complete your AS, transfer to a 4-year university, receive your bachelor's degree, and then transfer again into the doctoral program. Here at Lone Star, what we offer is the entry-level physical therapist assistant. Let's find out a little bit more about that. The physical therapist assistant works as part of a team with a physical therapist to provide care. We are experts as physical therapists in interventions. The physical therapist implements selected treatment components from the plan of care that's created by the physical therapist and obtains data that's needed by the physical therapist and makes modifications to those selected interventions. They assist the physical therapist in the treatment of all individuals of all ages, from newborns to the very oldest, and as you can see in the vignette, from the training room type facility all the way through rehab, acute care, hospice, home health care, outpatient clinics. So the variety is quite large when you really think of it. In order to get a physical therapist assistant degree, what you need to do is graduate from a community college that grants an Associates of Applied Science, receive that Associates of Applied Science, and take a national board. And yes, it is a national board. So once you get licensed in one state, that score will stay with you through your entire career.